Let me welcome you all with great pleasure. I think it is very important that we talk about this topic, depression in the workplace. It's a very important topic because it is the leading cause of disability worldwide, and it is at work where depression imposes the greatest economic burden. Throughout Europe, an estimated 1 of every 10 working people took time off because of depression. Just imagine this, that around us, at least 2 people, I would say, took already time off because of depression. It makes me feel sad in person. As one of the most frequent severe and disabling disorders, depression has become a common condition with significant and often unrecognized impact on employees and consequently their employers in all EU member states. Major depression ranks among the top 3 causes of disease burden. Mental illnesses in general have an independent economic impact. For example, in France, the health insurance sector spent in 2012 more than 20 billion euros to treat mental disorders. In Germany, mental disorders alone are responsible for more than 40% of cases of early retirement, or in the UK in 2010, mental health was the most common reason for claiming health benefits. The direct costs of depression amount at more than 90 billion euros per year, with up to more than 50 billion of indirect and non-health related costs, loss of productivity due to, for example, sick leave and early retirement. However, depression can be managed adequately. When this happens, people with depression lead productive lives and make valuable contributions to society as a whole. A number of businesses and private companies have started to recognize the important impact that promoting good mental health at the workplace has on the business as a whole. Through employment policy and legislation, the EU and its member states can ensure the protection of workers from inappropriate psychosocial risks in the workplace. Depression is one of the major challenges that occupational health and safety legislation will have to overcome in the future. The policy recommendations on depression in the workplace were published in October 2013. With the European elections approaching rapidly, it is high time to consider best ways to address this crucial health issue in the next European legislative term. I would like to leave now the floor to Irene Outman, I hope I pronounce it correctly, to set the scene by talking to you about the joint action on mental health and well-being, addressing mental health at the workplace. Please, the floor is yours.
Thank you very much. My name is Houtman, but it's Dutch, and the H is very difficult to pronounce, the beginning of a name. Thank you for allowing me to talk here to you. I will be talking about a project that's running right now. It's called the Joint Action on Mental Health at the Workplace. In fact, it is a work package of a larger project where depression or mental health is addressed, and the workplace is one of the work packages, so part of the project. Next slide, please. You said already something about the key challenges. Now you can see them a little bit, well, in writing. Starting with the fact that stress levels at work are increasing, are quite high because of, well, we know that globalization is taking place with leading to intensification at the workplace, leading to job insecurity because of the increase in temporary work, the tertiarization leading to more service work, and we already saw in recent data from Eurofound that it already resulted in violence and harassment increase, IT making well, workplace and time independent almost for a lot of professions anyway, not all. Changing demographics, which is important because we all get older, but particularly in Europe, the birth rate is lower, so we don't get as many younger. So we have to work on longer to keep on all kinds of, well, the values we prosper. It is already said it costs a lot. I can suggest to you to see, for example, the Matrix report in 2013, which gives you a lot of figures on this, impressive figures. And they already also say that the major costs are made on at the workplace where a lot of improductivity is there because of depression, as well as absence, but it's also improductivity because of presenteeism, which is appears to be increasing in a way as far as we have data. As depression is one of the major mental health diagnostics for disability, so, but there are, of course, others as well, or sort of, well, issues which are similar, like burnout, which is not everywhere acknowledged to be a diagnostic category. We know a lot about depression and also how to deal with it, also at the workplace. But the problem is that it's not done a lot. So there's also a lot of gain there. And that particularly is also the starting point of this project, the joint action. And well, it's just that there are some certain risk groups. Next slide, please. So the aim of the project is to make sure that there will be, at the end of the project, a sort of European action plan on mental health at work, both at EU level as when possible. I know that the Dutch ministries at least think so. It should also be taken to the countries themselves to that level as well. And essential ingredients for this to happen is, of course, it takes time, but to evaluate progress along that time, but particularly to share experiences on mental health and well-being, both at EU level and at the member state level. And also to commit and engage all kinds of stakeholders, so policymakers, but also employers, employees, people from the care sector, the insurances, both public and as well as private insurances, they have to do it together. That's the one of the main things of this project. And it should lead to building capacity and increased sustainability for mental health policies. Yes. Oh, it starts with mental health at work, but the approach is more broader. Well, from a healthcare perspective, you can see that it's about supporting affected employees and, when possible, returning them back to work, but also to manage risks at the source, so prevention as well, and even the third thing is to be ahead of all things, to promote positive mental health. Next slide. And that will be protection and promotion of employee health in relation to psychosocial stress or psychosocial stress management. This is a bit how the project is organized now. There are 30 member states, you can see them. From those member states, there are national coordinators, and I'm the one from the Netherlands. The project is led by Germany. And at the national level, we all are engaged with our stakeholders. We have stakeholder meetings, including employers, employee representatives, people from the sector, from healthcare sector, but also insurances, as said, and also from the occupational health care part. And starting at the national level, the project is organized in a way that it starts with a SWOT analysis at national level. So strengths, weaknesses, opportunities and threats analysis with all these stakeholders in sessions at the national level. The idea is to bring that to a European level, to integrate that, to see what are the generalities, what are the particularities. That's the stage we're in now. And these SWOT, they should result in some sort of a starting point to think about what should we do, what are the strengths, what are the opportunities, how can we beat the threats. And we are now ahead of a sort of a European exchange workshop where both at EU level and at member state level, people are invited to join and exchange information from the project as well as good practices in the different countries. And this will be taken eventually to to sort of a final project ending in end of 2005. So we still have some time to go on. Yes. This is a bit of the process, how it's organized, in a sense that we had a kickoff, of course, and then we did SWOT analysis in the past. Even someone is here in the room which for the Netherlands took part. And that has been fed back at the end of last year, both at the national level and at the European level. And we're now preparing the exchange workshop, which will be in October, and the Amsterdam and Berlin meetings will be swapped, but nevertheless. Yes, please. Oh. Next one, yeah. These are the highlights of the SWOT analysis. I think it's a bit difficult to read, but we are in the process of collating all the information. About the strength, well, there are good practices. So there are examples of how to really effectively manage mental ill health problems from those three perspectives shown before. Well, the weaknesses, in effect, well, there are some more saying that there is support both from national different stakeholders anyway on this issue, but one of the weaknesses is that still a lot is not used of the knowledge and of the tools that have been provided. So there's an implementation gap. That's the general thing. Another thing is that SMEs, for example, particularly the smaller organizations, are not really how to say it, reached very well. And you also see that lifestyle approach is still very prevalent, which has risk in it that, well, in a way, blame the victim, leave the victim with his problems. Even when they develop mental health problems, people are less well able to, accept or take challenges. And the general idea is that, particularly in organizational perspective, the workplace itself should also facilitate and support the employees. The problem there, that's another weakness then, is that it's still not a very accepted health problem. Managers don't like mental ill health. And it's also a very sensitive issue. It came out in the Essener survey, for example, in the European Enterprise Survey, where for OSH, for example, you see that reasons for not doing something has to do with knowledge or tools available. But for mental health, it is the sensitivity of the issue. It was come up most, the highest barrier anyway. So it's stigma, it's still a very difficult problem, which has to be encountered. Opportunities. Well, there is a lot of attention for it. We speak about it today, but we have a program. This program is supported by DG Sanko. There is another project now by DG Employment. So Europe pays a lot of attention. And I see that also in several countries, it really, well, they see the urgency anyway. So that's a good thing. But a big threat is particularly the economic crisis. You see that particularly when money is not so much available, that particularly risks which are, well, you can discuss about, they're not so very well objectively shown that this is, or there is a risk. As said, the sensitivity of the issue, well, particularly in economic sensitive times, it's not, well, it's easy to say, well, we don't invest in those kind of things. We take other priorities. There are increasing social inequalities. It seems that there is a group, particularly of the lower educated, for example, which are particularly at risk for these kind of health problems, and also have difficulties in maintaining their position at the labor market. They are the ones who are most prevalent in those temporary workplaces or out of work at all. So next slide, please. This is what we discussed about, and this might, together with what we conclude on the SWOTs, is a framework for determining action. We can discuss on these kind of things in relation to these strengths, weaknesses, opportunities, and threats. Either we, and it's not or, but it may be and. Awareness raising, setting the agenda, or some issues on which we should develop knowledge. As said, there is a lot of knowledge already, but discussing this, for example, with the Dutch stakeholders, they say, well, particularly on the mental health promotion or the positive issues, that's a rather new development, so we should think of how to improve engagement of workers to just make sure that well, the scene is set in a positive way. Implementation of knowledge is another thing which could be stimulated. redirecting roles, responsibilities, or thinking about the financing. One of the things, for example, was that in a lot of countries, including the Netherlands, it's not always the polluter who pays. And also when you do nothing, for example, as an employer, it doesn't mean that it costs nothing. It will cost something, but often then society pays. So, well, and you have things that, for example, public health and occupational health is paid in a different way, which also impedes or is a barrier to collaboration on that field. So there are also all kinds of financial issues where you could make steps. Doing something about infrastructure collaboration, or change legislation, or do something about the maintenance. This is something which is still under development, these kind of potential issues to address mental health at the workplace. And maybe one back, because the one that are made fab, these are the ones which are being prioritized by the Dutch stakeholders anyway. So they don't want new legislation, but they want to do something about the implementation gap and do something about the financing. Next one. Yes, this you already saw. It is sort of reminder that we still have some way to go with the project until, we hope to have been developed something. So this is my final slide. No, that one. Hope to tell you more about these issues some next time. And in the meantime, also your success in managing the mental health at the workplace. Thank you.
Well, we thank you very much for your presentation. I may announce the next speaker, Dr. Stavroula Leka from the University of Nottingham. And she will actually explore the challenges and the opportunities of engaging with the new European Parliament and the Commission. The floor is yours.
Thank you very much. I have been asked to focus more on the policy framework in Europe, and to look at specifically the health and safety framework, although I will talk about other things as well, and hopefully also what are some key opportunities and challenges in relation of the infrastructure in Europe and what we can do about it. I won't talk a lot about my first slides because you have heard a lot about it from Irene already. What I would like to point, if you can go back one, please, what I would like to point out is that still the debate on mental health in the workplace focuses a lot on the absence of disease. And this is a very much outdated perspective, unfortunately. And this is where a lot of the problems arise around the world. So as Irene said and referred to, a positive, much more positive perspective should be considered. And we should not be thinking about mental health in terms of absence of mental health disorders in a more conservative sense. We should be talking about a positive psychological state of well-being. And from this perspective, I will look at what are the issues that are relevant and how they are addressed in the policy framework. These are some statistics. Yes, the report that you very nicely put together, I was very happy to see that has a lot of costs. As Irene said also, there are other reports from countries I will show you in a moment. Overall, we have a lot of data that is now showing us that, for example, if we use the World Health Organization index and look at the European level, the mental well-being index, 23% of workers in Europe tell us that they report low levels of well-being. These are not diagnosed as depressed yet. This is 1 in 4 workers that is not diagnosed. And we have another 6% that clearly say, yes, openly, I am depressed in the workplace. So there we can see that probably there was some interaction with a physician, and we have some clarity on that. But potentially the problem is much bigger than we think it is. And the studies that have been done, particularly on the workplace, and the link between work-related stress and depression, because as I said, we shouldn't only focus on diseases, we should focus at issues that might lead to a negative outcome of the disease. We see that those who experience stress at work have a higher probability of being depressed, between 1.2 and 4.6. It is a big gap there, and that depends, of course, on methodological issues from the various studies. And probably I would say the truth is somewhere in between, but it is almost a 3-4 risk of developing depression. So we need to be doing a lot in terms of prevention, a lot in terms of addressing the issues before they actually lead to the disease. We can have the next one. This is a very interesting study that if you don't know about it, I would suggest that you read it. This study tried to look, it's a longitudinal study, the Geisel study that stems from France, and there they tried to see what happens when people retire and they are depressed. They didn't look only at depression, they look at other issues as well, as you can see, relevant health issues. But the question there was, if people are exposed to working conditions that are not ideal, or if we like to call them a poor psychosocial work environment, what happens to them when they stop working? Do we see an improvement in their depression or not? Because that's a huge argument. All our policymakers, of course, and we need to be talking about that, are saying that obviously people should be in employment, they should be working. That's absolutely right. We have a lot of studies that show that employment is good for us. But when we're exposed to a working environment that is not ideal, actually has the worst working conditions in terms of psychological and social aspects, I'm not talking about harsh conditions here, right? What we see is that their mental health improves when they retire. That argument might be then that, well, actually, for these people, it might be better not to be employed under these specific conditions always, right? Not in general. So you can see that where it comes to physical health, these problems do not go away on the left-hand side, obviously. They're perpetuated. Well, when it comes to mental health, we see a drop. So their mental health significantly increases after retirement. And these studies now have started to accumulate. We have a lot of more longitudinal data that paint the picture, and we have a lot of good arguments that we can use to do something about it. Next slide, please. Now, what is the cost? I mean, Irene talked about different aspects. At the individual level, of course, there is an enormous cost, especially if people are out of employment. And this is all linked to what we call the social determinants of health in our area. And that has to do with poverty, it has to do with exclusion, it has to do with bias and all the rest of it. At the organizational level, of course, there are different outcomes. Presenteeism is a big one. And if you see at all the data that is coming out, especially since the latest financial crisis in Europe and elsewhere, we see that, yes, the use of antidepressants rose significantly. The use of antidepressants rose also for those who did not lose their jobs. So the question there is, do we have people at the workplace that are underperforming because of poor mental health? And the answer to that is yes, undeniably yes. You can see it from the data. So we have a lot of suboptimal performance. The data we can see from many countries, and I have here from the Mental Health Foundation, just for stress, this is not for depression or for the diseases, 30.9 working days lost on average. If we go to the next slide, we have more data coming up. Yeah? So you have here from EU OSHA 50 to 60%. We have other surveys from France, for example, most lately, where we have a lot of problems in relation to this, 2 to 3 billion euros. And a very interesting report from Matrix that came out that shows a huge cost, that actually it's somewhere out there. It doesn't match the rates of the cost, this report, and it's interesting to show that they are even talking about 600 billion euros every year, which is an enormous cost. So there is a big societal cost as well. What we tend to be forgetting, and I will be talking about in our policy making, is the clarity with which we make the case for mental health in the workplace when it comes to all the factors that are associated with it. We have a very good framework in Europe. We should not feel ashamed of being proud about our legislative framework, I think, because it is the best in the world. There is no doubt about that. And I will say it with confidence because this is what I've been studying forever, for the past 20 years that I've been in this area. There are other countries that are also having a very good framework, but Europe always leads the way. And which is also comes with a certain level of responsibility, if you like, because the world looks at Europe about how they should be addressing different issues. Because, okay, we can always do better, but we have done already a lot, as I will show you. Irene said that employers do not like mental health problems. Yes, it's right. But maybe we're responsible a little bit there because we have not made our case clearly enough. So if we talk about issues such as psychosocial hazards, which is a horrible term, we all have to live with it, but people get afraid because there's still a lot of taboo in relation to psychological issues. If we talk about issues such as work organization and work design, no manager would deny that their business can do something about it, and it is in the best interest of the business to do something about it. My point is that the way we frame our arguments has to change a little bit to promote a more positive perspective. So let's see what we've done so far, if we go to the next slide. Of course, our directive is there, and it's not only the framework directive. We have other directives, they deal with all sorts of issues. I'll talk to you about a project that we're just finishing for DG Employment in a moment. We have done a huge review of all the legislation from the beginning in the European Union that relates to mental health in the workplace. There is, unfortunately, not a lot of recognition through the system of occupational diseases. There we have a problem. Some countries have reference to particular issues such as post-traumatic stress disorder, psychoneurosis, etc. But in many countries, it will all depend on whether there can be a clear and proven link between working conditions or even something more dramatic, such as an occupational accident, so that the outcome of poor mental health or depression, if you like, can be perceived as an occupational accident or an occupational disease. It's very hard to do that in many countries, although I have examples there that through this complementary system, as it's called, there is some level of recognition. So it would be nice to look at how these have worked and to compare the case studies of good practice. We've also, of course, have a lot of other, apart from law, a lot of other voluntary approaches, as we call them. And since 2004, when we had the Framework Agreement for Work-Related Stress, which was a landmark, I would say, agreement, we have seen that there has been a lot of action in this area, and the debate dates before that, but essentially since then there has been a lot of awareness. There are other things. We have the European Pact for Mental Health. Recently we have the Senior Labour Inspectors Committee, a campaign on psychosocial risks. EU also just started a new one on psychosocial risks. There are also some relevant standards, and that is quite interesting. We have, of course, the ISO that dates back to the updated 196. In the UK, in 2011, we had the first guidance standard on the management of psychosocial risks in the workplace. It's called guidance standard because, for anybody who knows about standards, it's not auditable, right? You cannot go and give a badge to an enterprise after auditing. And the reason that is not auditable is because the agreement, even in the UK, where you have a lot of knowledge, was not there between the social partners at that level and the government. They are reconsidering now turning that into a British standard for mental health in the workplace. So that would be an interesting development. And we've had similar developments elsewhere. On the other side of the Atlantic, for example, Canada has a standard on psychological health and safety in the workplace. So these are nice developments of the last years. So where are we? Of course, everybody knows that the picture across Europe is very diverse. There's a lot of data that's coming out, especially though from certain countries. The European data collection has been fantastic in that sense, because in a lot of countries we have zero virtually data coming out across the Union. So we do rely on the monitoring system across the European Union. It's very good. However, we have very limited evaluation of what works and under what conditions. It's very difficult when you have such a mix, and such a policy mix as well, between member states. What has been shown to work? We have a lot of good examples. We have, of course, differences in social security systems that have something to do also with the recognition of depression or other mental health problems or occupational diseases. We can do better in terms of sharing good practice, and this is what the EU also is trying to do with a new campaign. But I would say there is still a lot of poor understanding around by businesses and also, unfortunately, by policymakers, which is why this initiative is very, very nice and should be applauded. So we can do better and we can do more. So if we go to the next slide, we'll see that first, we need to have better awareness, better use of the level of knowledge that we have and the evidence. We have a lot of evidence out there. We need to be using it better. We see that there are some agreements also at European level and some associated action. Also the new project that Irene talked about is one example. However, what we lack is strategy, and I hope I'll hear something from you after my presentation on that. What we lack is a strategic approach, both in policy making and then, of course, at the organizational level. That is to a very much extent linked to lack of clarity and a limited perspective, because everybody, as you saw now, Irene's presentation is talking about the business case, the economic consideration. We know the business case. If you look at the data that are coming out across Europe and elsewhere, the business case is extremely strong. But we should not only be talking about the economic consideration, the business case, but there's a very strong ethical case here. And we should be starting from that and moving forward. And that, of course, is what Europe is all about, and we should not be forgetting that. Okay? And the next slide, and the final slide, I think this is, we have the project that I mentioned, a project that has been funded by DG Employment through Progress. And what we have been doing so far is a review of all the policies that are relevant to mental health in the workplace in the European Union and in different member states. And what we have been asked to do is to develop different policy scenarios. So where should the Union go next? Should we have more legislation? Should we update our existing legislation to be more precise when it comes to these issues? Or should we just make sure that everybody understands the law, the key directives and pieces of guidance that are out there? This project finishes in June. We'll have a meeting here in Brussels on the 24th, I think, 24th, where we'll be discussing that with the views of the various stakeholders. But what we need is innovation. And innovation, the big thing in the European strategies, we need to innovate in our thinking and we need to innovate in our acting. And I think that was the end. Thank you very much.
We thank you very much for your clear words. I think it is a call on all of us. The next speaker is Mr. Francisco Hidalgo. I hope I pronounced the names correctly. Deputy Head of the Health, Safety and Hygiene at Work Unit in the Directorate General for Employment at the European Commission. And he will present the view of the European Commission on the place of depression in the policy strategy. The floor is yours.
Thank you very much, Mrs. Werdman, and thank you to the organizers for having invited the Commission. It's a pleasure for me to be here, and thanks to the Parliament for hosting this policy debate. First, I would like to say that the Commission attaches a lot of interest to mental health and prevention of psychosocial risks in general. And this interest is not something new. Already in 2002, in the first EU strategy on health and safety at work, the Commission specifically mentioned for the first time in this strategic document the need to adopt a global approach to well-being at work, not only to prevent accidents at work and occupational diseases, but the ultimate aim of improving well-being at work, taking into account the emergence of new risks and, in particular, the emergence of risks of psychosocial nature in the workplace. In this context, this strategy put a specific emphasis in psychological and social risks in the workplace. And this EU strategy 2002-2006 triggered and inspired something that in our view is very interesting, the joint action of employers and workers, because the European social partners, employers and workers organizations, concluded two very important agreements on prevention of stress at the workplace and on violence and harassment, respectively in 2004 and in 2007. For the first time, the European social partners were together and committed to improve these key elements in the workplace. And now we have some perspectives and some experience that we have learned from this process. And, for instance, the fact of launching these agreements for the social partners agreements increased a lot the awareness about the problem. Because now we have some studies and some statistics that confirms that the level of awareness, especially among employers, about the importance of keeping and promoting mental health at the workplace is much higher than it was 10, 15 or 20 years ago. And that's very positive because, well, you are experts in this field and you know very well that it's important, is crucial to raise the, let's say, the profile and the visibility and to break the, let's say, the silence wall about this kind of psychosocial mental problems, depression, and so on. So there are some important aspects that we have learned in this process. The Commission prepared and approved later on in 2007 a new strategy on health and safety at work for the period 2007-2012. And in this specific strategy, the Commission encouraged member states to foresee in their national strategies specific practical measures to improving mental health and to promoting mental health in the workplace. And that, in our view, was very positive because now we already know the results of this strategy. The Commission published last year in 2013 the evaluation of this strategy, and now several member states in the European Union already have specific initiatives at national level, of course, to better protect and better promote health and safety at work, and in particular mental health and psychosocial issues. So in this strategy 2007-2012, for the first time, depression was specifically mentioned. Because, as you will remember, it was mentioned that the World Health Organization, WHO, considers that by 2020, depression will be the first cause of incapacity at work. So this is the very clear sign that this strategy, EU strategy, launched. And now, with this perspective we have about the last years and the way in which member states have are been tackling these kind of issues, on one hand, we are more confident because we know that the level of awareness is much higher. But on the other hand, we are as well aware of the fact that much more needs to be done at EU and at national level as well. The situation in member states is very diverse. Professor Leka already mentioned that. When we analyze, for instance, the results of the implementation of the framework agreement on war-related stress, we see that the level of implementation of the awareness and promotion measures is very varied among member states. Some of them are very actively committed to take specific actions. Others are still considering the better way or the best way to tackle these kind of issues. But in any case, another element that we have learned in this process is the crucial importance of providing companies, and in particular micro and small enterprises, with practical tools. Because, as it was already mentioned, I think it was Professor Leka, the issue is not only to address the disease itself or the problem of depression itself, is to act in the prevention of the factors leading to the disease before it appears. So in this, let's say, preventive approach, let's be realistic. Many companies, in particular small enterprises, don't know very well what they have to do to prevent and to promote. They are concerned on one hand because absenteeism and presenteeism are phenomena that are now much better known. But on the other hand, the companies, and in particular the micro companies, don't know very well the practical measures and the practical strategies that they can implement in order to prevent. And this is why, in our view, it is crucial and it is essential to promote awareness on this issue, continue promoting awareness. Yesterday, Commissioner Andor launched, together with the European Agency for Safety and Health at Work, the biannual campaign of this agency. We call the Bilbao Agency because this European Agency for Safety and Health at Work is based in Spain, in Bilbao. And this agency launched yesterday a biannual campaign on preventing and managing stress and psychosocial risks. And during 2 years, starting actually yesterday, this campaign carried out by the agency in all the member states, actually not only in the member states of the EU, but in other European countries. In total, there will be 30 countries, 30 European countries actively cooperating in this campaign. A number of awareness actions will be developed. And I think it's particularly relevant to underline the importance of, and this will be done under this campaign, providing practical tools and practical advice to workers and employers on how to deal with this kind of psychosocial risks at the workplace. Because you know very well that sometimes there is some, let's say, fatalism about, well, work is stressful sometimes, life is hard, and sometimes people consider that it's not easy to tackle this kind of threats. Now we know very well that there are specific strategies, specific measures that can effectively contribute to promote and to increase well-being at work, and in this way preventing the very serious effects. I will not repeat the very impressive data that have been already mentioned here about not only the human suffering, but as well the huge economic impact on European companies and on the whole EU economy, and in the productivity and competitiveness of the European economy. Particularly now, we are living difficult times of crisis. Well, the situation is now a little bit better than 2 or 3 years ago, but now we know very well that the impact of the crisis has been very serious, in not only in terms of losing thousands of workers lost their jobs during the crisis, but we know as well that the insecurity about keeping or not their own job is a very important stressful factor, and that in some cases is very stressful to be unemployed, but it's very stressful as well to keep the employment, but with the threat of maybe being dismissed or losing their job soon. So it is obvious that the psychosocial environment over the past few years has suffered from the impact of the crisis. Another element that I would like to underline is the fact that now we have very strong economic evidence that investing in health at work is a very good business. Very often it is seen like as a burden for the companies, as a more or less difficult to assume cost. Now we know that beyond that is a very good investment. For each euro invested in preventing and promoting health at the workplace, there is a return in not only for the companies, but for the overall social protection systems in terms of reduction of absenteeism and of cost of social security, healthcare system, etc., of more than 2 euros. So, and this is particularly relevant to be stressed and to be underlined now in difficult times. Yesterday, in the presentation, in the launching of this European campaign for managing stress and psychosocial risks, Commissioner Andor announced that the Commission is preparing a new EU strategic framework on health and safety at work, which is due to be adopted in June. We don't know yet exactly the precise date, but in principle in June. So we consider that this strategic approach is important, and it is important not only for the specific case of psychosocial risks and mental health, but for improving in a consistent way occupational safety and health all over Europe. And that's important because not only for workers, it's obvious that for workers is very important, but as well for their families, for the overall economy, as I mentioned, and for the whole society in Europe. If we would like a better society, a more integrated, in line with the Europe 2020 objectives of a smart, sustainable, and inclusive economy by 2020, health and safety at work is one of the key elements that have to be promoted. I remain at your disposal for any question or comment. Thank you for your attention.
So the next speaker is Mrs. Amelia Mustafa. She is the Executive Director of the European Depression Association. Please take the floor.
Hi there. Hello, everyone. Yes, my name's Amelia, and as well as being the Executive Director of the European Depression Association, I also run a mental health charity in London that uses work to help people recover from serious mental illness, including depression. So I know firsthand the role that employers can play in managing the burden of this disease. So first of all, I'd like to set the scene. I know others have done that before me, but depression primarily affects people of working age. And in a survey that the European Depression Association did a couple of years ago, we looked at 7,065 working aged people and found that 1 in 10 had taken time off work for depression, but only a third had told their employers why they'd taken time off. Now that means that not only is depression a very common condition that has a significant and importantly unrecognised impact on employers as well as employees, it means that we've got people sitting at their desk that are too ill to work. And presenteeism is becoming as big a problem as absenteeism. The right kind of work, as I mentioned, aids recovery, and it's really good for mental health. But there's so little understanding and there is so much stigma left that policymakers really must provide guidance to employers. So what I'm here to do today is to convince policymakers to strengthen the role of employers in any policy where they can do that. Now, the employee-employer relationship is unique, and employers have a role to play in improving prevention and early intervention. Now, that might sound strange, that might sound the role of medics, but actually they can make improvements in the work environment. They can ensure that there's mental health promotion around. They can ensure that people take a lunch break, that there's a culture of supportiveness and no bullying. They can do early recognition of depression because they've got objective measures of how someone's brain is working, of their cognitive function. Now, I'm going to talk about the cognitive symptoms of depression a bit later on, but depression is a disease of the brain, and you can see when it's not working properly as an employer, and you have the opportunity to signpost people to support. You can also help them implement a recovery plan by doing things like giving them time off for appointments, making sure that their workload is manageable whilst they're in recovery. And, of course, employers can promote good mental health. Can anybody here actually define good mental health, what that is? because that's really interesting, because it is a really complex subject, and I believe that it's a biopsychosocial approach to well-being. The brain is an organ just like any other part of the body, and it needs feeding, it needs exercising, it needs challenging, it needs supporting, it needs friends, it needs family, it needs all of these things. And employers have a real role to play in promoting that awareness. No, sorry, I can go back. We need to provide support when mental health is at risk. For example, if companies are downsizing, that's a really stressful time, and you would expect to see rates of depression going up. But there's a way of delivering those messages and handling that situation that is very kind to mental health. So the responsibilities of employers around depression in the workplace must be clearly defined and communicated by policymakers. And that's because employers just don't see it as any of their concern right now. First of all comes education. You can't make changes without a good understanding of what depression is, and particularly how it manifests in the workplace. Now, I mentioned the cognitive symptoms of depression. Most people think of depression as a mood disorder. You're sad, you're helpless, you're hopeless. But actually, in up to 94% of the time in any depressive episode, you have these cognitive symptoms that mean it's difficult to focus. Your attention is everywhere. You can't see a situation for what it is, grasp it and respond to it. And making decisions is really difficult. Now, if that impacts your effectiveness, you're going to start withdrawing from work, and you're going to see levels of absenteeism rising. So it's really important that we understand and promote awareness of the cognitive symptoms of depression. We need objective measures of work environments and the impact of interventions. And what I'm saying is we need to know what works and we need to do more of it, and we need to know what's harmful or what doesn't work and do none of it. Employers and policymakers should work with healthcare professionals and patient groups to develop educational materials for use in the workplace and wider society. And I'd actually go further than that, and I'd say we need to fund innovation in this area. We need to fund partnerships that are going to produce this new work. As I said, I'm from the European Depression Association, and I need to plug our day, which is an awareness-raising day on the 1st of October. We will be having an event here at the European Union Parliament, and we would really love if you could come. We'll also be spreading awareness throughout Europe to members of the public. And what we also hope to do is raise awareness of mental health, because that needs to be understood, promoted and protected as much as the illness. So as well as employment legislation, EU health and safety policy provides an excellent vehicle for guidance. We've made amazing progress on dealing with physical risk to workers in the workplace, like, for example, dealing with sharps. But now we need to look at psychosocial ones. And I'm not sitting here and saying that's easy. What's one person's stress that motivates them is another person's stress that will make them ill. But legislation can support better working environments and the provision of practical support to employees with depression and other mental illnesses. Relevant policies include things like the working time directives, corporate restructuring, anti-discrimination law, and posting of workers. These all represent opportunities to talk about depression. So I want to talk about 3 specific policy changes. Health policy must recognise the role that healthcare professionals play in treating patients with depression according to evidence-based guidelines, which take into account a person's work situation, because quite often they don't. Health and safety policy should promote and acknowledge psychosocial risks in the workplace and seek to reduce them by promoting simple risk assessments and offering practical advice and tools. And legislation that supports workplace employee education should be updated to include advice on depression and overall mental health. But how do we implement all of this? I mean, I actually think that writing the policy is the hard bit. I think implementing it is the easy bit, because it's common sense stuff, and it's what the best companies are already doing. But national governments can really help by setting up mental health commissions who would have responsibility for things like ensuring all stakeholders understand their role and the possibilities of intervention, creating educational materials, fostering communication between health and employment policymakers, because we need to break down the silos. This isn't just a health issue, this is a social issue, it's a workplace issue. We need to further develop the value argument to support interventions, because, as my colleague mentioned, there is a return on investment here. Depression costs the employers €54 billion a year. It's a fantastic amount of money. And actually, they get money back by investing in dealing with this condition. And we need to manage a form of follow-up with employees to make improvements. So we can use the carrot and stick method. Yes, we can incentivise, but we should also look at penalising employers who persistently make errors in dealing with this disease. And member states should create a mental health action plan to reduce psychosocial risks in the workplace. Now, I think in your folders you'll find that there's a Depression in the Workplace Policy Recommendation Guide. And in there is a case study of Canada, because the Canadians do this really, really well. So it does work. And how do we get employers to invest in this? Well, it's in their interest to do it. The burden of depression is huge, 54 billion euros. Various companies are already doing something. British Telecom, they implemented a mental health strategy, and these are some of their key results. They saw a 30% reduction in sickness absence due to mental health problems alone. There was a 68% of employees learned something new about looking after their mental health, and 51% of employees noticed improvements in their mental well-being. So not only have they got reduced costs from sickness, they've probably got really loyal employees as well. The European Depression Association survey that we ran a couple of years ago found that 1 in 3 managers felt that there just was no formal support in place for them to manage depression, and they would welcome support and tools. So actually, employers are ready for this. They're asking for our help. If we create a model workplace recovery pathway, it makes it simple for people to know what their responsibilities are. And I'm really pleased to announce that there's a new forum for employers to share best practice and offer practical advice. It's called Target Depression. BT are one of the members of it, and I'm expecting great things from them, so hopefully we'll have something to report on the 1st of October. And then finally, how do we get employees to implement? Again, it's back to education. We need to raise awareness and reduce stigma, because I believe that stigma is the one thing that stops people seeking help and getting it. We need to teach employees to recognise depression in themselves and in others, and then we need to show them what to do when they've got that knowledge. So at induction stage, we should be telling to our employees, this is our mental health policy. If you feel unwell, this is what you need to do, this is how we will treat you, and this is what we expect from you in return. We need to look at prevention. We need to encourage employees to protect their own mental health. Health and safety is everybody's responsibility. We need to make sure they're doing things like taking a lunch break. We need to help employees to recognise risks to their mental well-being and raise that concern. So if their workload is too heavy, for example, they can go to their line manager and say, I need some support. And finally, if someone is sadly off ill with depression, we need to help get them back to work quickly, as long as work isn't the reason for them being depressed. Because the longer they stay off work, the more likely it is that they're going to remain off work. So we need to do things like stay in touch with them, give them welfare meetings to help them get back to work quickly. And just generally support the idea that work is good for their health. So finally, all stakeholders hold a piece of the jigsaw puzzle, and by working together we can reduce the burden of depression. But it's only policymakers that have the bigger picture and can provide the way forward that we need. Thanks very much.
Well, we thank you very much for your outline. I know that Rebecca Müller, the Secretary General of the Global Alliance of Mental Illness Advocacy Associations, would also like to mention some findings of a recent survey they had carried out in the topic of workplace mental health. So please take the floor.
Hello. Thank you for giving me the chance of having 5 minutes in this very interesting meeting. I'm very glad to be invited and to hear the speakers. So I am representing patient organization. We call it Gamian. You don't have to mention all the details. It's too difficult. Gamian Europe. And we represent persons affected with mental illness and their interests, and we try to get mental health awareness on the policy and defend their rights and talk to them. So we bring together all kinds of self-help groups, patient-driven groups where the patients take an active role in their organizations, all from Europe. So self-help groups, peer groups, run by patients with professionals, but we all bring them together, exchange good practices, and want to spread their word, make their voice of patients heard in different policies. And one of the things we do is we do several surveys on subjects that we think patients are struggling with in their lives. And one of the surveys we did is on workplace and mental health. That was in between April and July 2013. Of course, it is just a little sample. It's not really a big, huge scientific study. We have scientific partners that help us with evaluating the results. And we make questionnaires with several questions. We have a steering committee working together where patients are in, professional policy experts, to make a questionnaire about the issue, and we translate it in the 22 languages so that our patient members can fill this in online, or they can download the PDF. So we distribute it through our network of members all over Europe, online website, and we had, so we can see the experiences and the real life problems that patients face with their mental illness and the combination of work, keeping work, going back to work, what are the barriers. And it seems that what Amalia said is very true. Work is important. It is a factor of recovery. It helps you because when you get an illness as depression or any other illness, I myself have been diagnosed many years ago with bipolar disorder. So when you get this illness, you have to cope, get your life back together, and one of the things you want in your life is to take up all your social roles again, and one of these social roles is work, and work can be very helpful, can give you that sense of I am worth something, I can do something for society again. I might have had an illness or I might have this for the rest of my life, but I still am worth as something, and I can contribute to society. So for many patients, work is important. It is one of the societal roles they want to keep and take up again once they had an illness. And the barriers to do that is, of course, the stigma, and that employers don't understand how to cope with people with depression who have had a diagnosis. And the patients themselves feel that very strongly. They see themselves, we ask general questions, what would you feel that would have supported you, or what could your employer have done? And they said, they didn't know about it, and they didn't dare to speak about it. They were absent from work. It was stressful for them, came back, and they didn't have the freedom to talk about it. They would have so much liked to get support from the employers, as you say, training the employers, training the companies, the HR service, that they can openly talk about it and say to this person that comes back from sick leave, you know, we know what happened to you, we can make some arrangements that you have less stress, or come back part-time. And most patients didn't get that, so they are out of work, and 60% of who are momently out of work on this survey said they're not happy about it. They would like to go back. But this huge stigma barrier and lack of training and lack of understanding from the employers, from their colleagues, is the huge barrier that prevents them of keeping their job or going back to the same job. I myself lost my job because I was ill. I had to change and find another career and get another training. And it took me, I mean, three years to get my life back together, to get a training and have another job. And I didn't speak about it. I kept my mouth shut. At every interview, I didn't say it. I had a story ready. If they would ever ask me why I was out of job a few years, then I had a quite very decent story, but it wasn't the whole truth, because I didn't want to take the risk. I didn't want to have the risk, again, that somebody said, oh no, you have this story of your life, we don't want you. So I can understand the stigma and the fear of people to talk about it. So we really should fight this, fight the stigma, tackle the stigma, and inform and educate. And I think that would be very good. And if we can say that the employers get benefit from it, they are motivated to do it. I know in Belgium there are systems where people who had a problem, either social or mental illness or anything, the employment service in Belgium can get them a traineeship in a company, and the company knows that this person has had some kind of problem, but not exactly what, and they get some tax reduction for this person. So it's actually cheaper to get them in, and once these persons are in and they show that they're a reliable worker, most of these traineeships end in a job. So this is something, not only the beneficial thing on the ethical or the mental level, but maybe on the money level too, to get these small companies to employ people who had some quirk or had some experience. That would be something that policies could include. Just an idea. So that's my story. Thank you for listening.
Well, I thank you very much, and we thank you very much for sharing your story with us. And I think I believe that everyone will agree with me that it takes a lot of courage to talk at this level about your personal experience and about your personal story. And I wish that many more had courage to talk about problems, whatever problem it actually is. It takes a lot, and it takes a lot to listen. Unfortunately, this is not very widely found, I must say that. So thank you very much. I'm sure there are questions. Whoever has a question now to the speakers, please let me know. If there is no question, this is impossible. Please go ahead.
Thank you very much. My name is Joop van Grienven. I'm from Pain Alliance Europe. I'm actually here because I'm interested in the dimension, but I'm also having an event in Parliament ourselves, so that's why I was here. I've heard all the speakers talking about the stress situation. I've been hearing what the employees should do. I've been hearing about how to change the view on it. But I haven't heard how the patients or ex-patients are really involved in the whole matter. Could you give me some information on that, please?
How patients are involved in creating in this work.
In the work package, in the development for prevention and all that.
Okay. Yes, I think having service user involvement, as we call it in the UK, is vital. And certainly the European Depression Association is made up of patient organisations as well as doctors and psychiatrists and GPs. And we work together to create these recommendations and to campaign and lobbying. So from our point of view, we have patients on our board. I was a carer for someone with depression.
Is that patients in the health sector, but also in the working situations as well?
Mm-hmm, yeah.
No, just to have the pleasure to inform that for the 1st October we have organized the European Depression Day. I would like to invite all of you to join us with your support and, if it's possible, with your contributions.
Thank you. My name is David Tordrup. I'm a health economist at the WHO. The question is mostly for Ms. Mustafa. You mentioned that a lot of managers don't feel that they have support to provide mental health support for their employees. And it was also mentioned that there's an effective business case for investing in mental health prevention. But I wonder, in the daily routine of running a business, giving people lunch breaks and getting people to have a lower workload is, I think, very unusual. What the situation most of us have, not even just in private companies, but in every organization, is that there's more work than there's hands to do it. So how do you deal with the reality of things that there's an inherent conflict between giving people a break and getting them to be more productive and competitive? Thank you.
I absolutely agree. I'm also an employer of 40 people, so I do understand the challenges of the workplace. But depression is the canary bird on society, and it's telling us we're doing something wrong. So actually take a break, take some time to breathe, stop getting ill, because you're costing the economy. That's what I'd say. We're talking about 54 billion euros a year lost. What we're doing is wrong. That's my only answer. But as an employer, I do understand that perspective. And actually, I found that once people do things like take a lunch break and take their holidays regularly, their productivity increases massively.
I think it's an interesting question, and I think what, to a certain extent, also EU OSHA and others have tried to do at the European level is to promote more awareness about what psychosocial factors are. Because I said it's not the most user-friendly term, but psychosocial factors essentially, if we take the individual things, right, which has to do with work scheduling, your role in the workplace, job description, all the rest of it. It's what good business management is, right? So if we see it from a purely, forget us psychologists, forget sociologists, forget health and safety experts. If you see it purely from a business management perspective, what every manager should be taught in a business school, ideally, is how to make their workplace more productive. These are issues that have to be addressed if you want to make your workplace more productive. So it's not a matter of whether I give a break so that people breathe. It's how do I look at what I'm doing, my operations, my work processes, and try to make them more efficient. And in modern society, the way in modern workplace, as you say, because the demands are there and they're higher all the time, we have to be more innovative, and we have to actually implement actions that are fit for the modern work environment. We cannot implement management systems that are archaic and expect the same results. Thanks.
Next question. Yes, please.
One comment also, and that's also what came from at least discussions with the Dutch stakeholders, that is that this area is more and more linked to well, sustainable employability, if you want to say, because we have to work longer. You have to be not well, use employees like you press the citron or whatever you want to do, the lemon or whatever you want to do. And another issue, another area which is also linked to social sustainable employability, social innovation, for example, which is also, as Tarula suggested, to use the workplace in an innovative way, but take care, because a lot of work has to be done with people. It's people and information, which is work nowadays is about. So you have to do that in a very innovative way. And there too, it's about productivity and being smart in organizing.
Next question. Yes, please.
My name is Chris Nuss from the Dutch Association of Mental Health Care Providers. I was wondering about the implementation gap, because I hear the European Commission saying we have made progress in the last decades. In England, we have time to change. Since 2007, quite a huge destigmatization program. But what has it delivered? Because the recurring companies are British Telecom, Boots, Danone in France, for example, are at a high level. These are major companies. But for a small and medium enterprise with 10 employees, who has a general director, who is, by the way, also financial director and HR department, and has to take sometimes the garbage out, it's a different perspective. So I was especially wondering, because small and medium enterprises are the largest employers in Europe and take the largest burden also. They account for 400 billion of those 620 billion euros. How can we help them to take the right decisions? And that is not very clear yet for me when I hear you speaking, and which is also, I think, the major challenge when you look at it. The second point would be people are unemployed, becoming depressed, and when you have a depression, you will not come back at work as easily as before. So that is another effect of the economic crisis. And we must prevent that all the efforts are in the present companies and the people still employed, but we forget millions of people, also youths in Spain, in Greece, in Italy, who are unemployed for a longer period of time, and that affects their mental health. So there are two populations at risk, which I didn't mention, before, or enough emphasis. So that would be my message: what to do to implement it really on that level. Thank you.
Thank you. Any other questions? Yes. Any other questions?
Can I say something to
Please.
you in response to what you said? Because I think awareness is, I think the answer to your question is not easy. And a lot has to do with awareness. Also at the national level, I know the Netherlands has been, a country where a lot of attention has been paid in the recent years on this topic. For example, like the work health governance, where at sector level it was stimulated to collaborate, and networks were formed. And in that period you saw a lot of activity. But when that was that initiative, how do you say it? It was not, but it faded out when there was no attention, no awareness anymore. And I was being very closely involved in, for example, the police sector, where a lot of things happened in those years. But when awareness is lost, all these activities are lost as well. So it's also a matter of something which flows with awareness. so the problem is, I think, maybe also how to maintain this awareness, this level of awareness, and also how to make people learn from one another, like make organizations learn from one another, because I think there is one of the biggest gains to leap over the implementation gap, maybe, because it has already been said, we know a lot, and also some things are not that difficult, because it's also in proper management that has a lot of the clues on how to make sure that people don't get depressed, at least, or don't get mentally ill. And often it starts with fatigue, where people lose energy and start feeling insecure and, well, fading away as a person. So, and making these networks, stimulating these networks together with awareness, I think very important in keeping up and learning from one another and, making the society a good place, anti-depressant.
Well, if there are there's one, okay, yes.
Would that not justify a kind of implementation program? Because when there's a lot of money in the European Union going to innovation. In this topic, we know what really should be done, and we know there's a huge economic problem and an ethical problem, and we know this problem will only increase. So I would like to ask for an implementation program for professionals, general practitioners, for people in mental health care who are not aware of this either. I mean, they gave contradictory advices sometimes to their patients, to get them to apply the knowledge that has been available. And that is not an easy task, but the business case is very compelling when you look at the numbers. So would it be possible to make a kind of European, or in the member states, a national implementation program to fight depression at the workplace and to apply the knowledge we already have? So that would be, and I know it's a hard job.
I think it's one of the aims of the project I was talking about. So, but it's still very difficult because already when I speak and for what I see happening there in, for example, the Netherlands as well, is that we have, for example, two ministries who are very, the Ministry of Health and Social Affairs and Employment, who are very eager to help promoting the good cause, but still they have their own programs. So, and it's difficult to, well, collaboration is difficult. That's what is shown again and again, I think. Yeah.
Well, no problem. Well, I think we can understand how difficult the actual debate is just from your exchange of comments now, I believe. Let me conclude. Let me thank you for all your comments that have been made, for all the statements that have been made. I think we can understand the incredible impact on Europe's economy and society if we follow this discussion, and what the actual impact of depression on the workplace really means indeed. I believe I can say in all our names that we can call on the next European Parliament and on the new Commission to take forward the recommendations and also addressing especially the depression in the workplace. I would like to quote Commissioner Borg, who said recently, Europe's success as an innovative, productive and competitive economy depends on healthy brains and healthy minds. And in this way, let's stand united for the fight, for the attention that should be given to the issue of depression on workplace. And I thank you all for your presence here, for your interest and for your commitment. Thank you very much.